How can cupping help people who have lipedema manage their symptoms and prevent it from getting worse? My name is Katie. I'm an occupational therapist and a lymphedema and lipedema specialist. I treat a lot of patients who have lipedema, not only in the clinic, but also virtually. Something that I teach my patients in the clinic and virtually is how to do cupping to help manage lipedema symptoms. This is a somewhat new technique in the lipedema world, as we don't know a lot about lipedema, and trying new techniques that we're using for different diagnoses on lipedema can really make a difference. So let's start with, what is cupping? So some of us have remembered or have seen Michael Phelps back in the Olympics, seeing all those big circles on his back when he'd get out of the pool. That is a sign of cupping. And so cupping can cause a staining. It's a chemical release, even though a lot of us may call it bruising. So the body releases chemicals that cause that staining. Number two is cupping separates the different layers of tissue. So in the ideal world, or the ideal body, we want that tissue to glide and slide nice and easy so that the lymphatic fluid and other bodily fluids can move like it should. When tissue is tight, the fluid cannot move. So with people who have lipedema, they have that tight, abnormal fat tissue, and that blocks that fluid from sliding and gliding and draining where it should. Hence the lymphatic fluid and the lymphatic component that sometimes start to be seen in people who have later stages of lipedema. So cupping separates the different layers of tissue, including that lipedema tissue, and it's hopefully getting it to move easier against itself. I like to do some manual techniques when I do cupping, and this is what I teach my patients to do at home, because by doing manual techniques with the cupping, then it softens the tissue. Again, going back to the main goal of trying to soften the tissue that's abnormal fat to let the lymphatic fluid, the blood, and other bodily fluids move like it should. Not only does that help with less swelling, but it also will help soften the tissue so you have less pain. So here's something that a lot of people with lipedema have a hard time managing: pain, tightness, and swelling. So cupping is a great tool that you can do at home and to help you manage these symptoms and to help prevent it from getting worse. Cupping is an inexpensive tool to do at home. So you can buy cups, of course Amazon has them, and other places online, and you can do it to yourself. So you don't have to wait for a practitioner, a therapist, a family member to do it for you. Also, cupping, I would say, is my patient's top tool with managing their lipedema at home. Once I do cupping and teach them how to do cupping at home, almost all of my patients come in the clinic and say, that's the one I'm doing the most, is cupping. So cupping is a great tool that has been around for a long time, going back to Chinese medicine. But I think, and I see, and I know that cupping is a great way to help manage lipedema. To learn how to do cupping at home, I've put together a mini virtual course where you can purchase it online. I go through everything with cupping: the science behind it, how to do it at home, what cups to buy at home, even exercises that you can do with your cups at home. So when you do the cupping, it separates the layers of tissue, and then you get muscle contraction with it, and it's definitely a double whammy with helping you heal and feel your best. So in the description, I'll link where to buy that cupping course. And like I said, it's great for people who have lipedema. It's also great for other things. So tightness up in the shoulders, your back, lots of different ways you can use cupping to help in addition with your lipedema.